The Ministry of Health, Wellness and Elderly Affairs joined the global community in commemorating World Tuberculosis TB Day on March 24, 2025, marking 43 years since the initiative began and 143 years since the identification of the mycobacterium tuberculosis. This year's theme, We Can End TB, Commit, Invest, Deliver, reflects the ministry's dedication to eliminating TB in St. Lucia through ongoing public education, proactive case detection, and provision of free treatment services. In 2023, St. Lucia reported only 2 cases of pulmonary tuberculosis, one resulting in death, with no recorded instances of HIV or TB co-infections. These figures highlight the nation's low-burden TB status as recognized by the World Health Organization (WHO), fewer than 10 cases per 1,000 people annually. However, health officials stress that even a single TB-related death is unacceptable. Senior Medical Officer in the Infectious Diseases Unit, Dr. Gail Kajada, emphasized the need for continuous public awareness and health system preparedness in the fight against TB.
If St. Lucia is to end TB by 2030, we must have a sustained commitment to doing so. This requires continued financial investment, as well as the effective delivery of interventions that are critical to TB prevention, diagnosis, treatment, and care. We all must own our responsibilities to ensure the end of TB in St. Lucia.
The ministry is committed to providing free TB screening, testing, and treatment services throughout the public health system, with a focus on individuals with chronic illnesses, impaired immune systems, or persistent coughs who are at higher risk for developing TB.
If any one of us is diagnosed with pulmonary TB, we can spread it to persons we live, work, and play with through coughing, speaking, and singing. Taking the recommended TB medications as prescribed for at least 6 months will cure TB. If you have been identified as a contact of someone who has been diagnosed with TB and a public healthcare worker gets in touch with you about getting screened and tested for TB, please follow their advice.
The ministry also urges parents to ensure that their infants receive the BCG vaccine, which protects against severe forms of TB in early childhood.
The BCG vaccine is a form of immunization given to infants to protect them from developing meningitis due to TB, as well as disseminated TB, meaning TB that spreads to major organs in the body, including the lungs. Please ensure that your infant receives the BCG vaccine as scheduled, unless otherwise advised by your medical practitioner.
As St. Lucia aims to eradicate tuberculosis by 2030, the ministry calls upon all citizens to contribute to this goal, whether through testing when necessary, completing treatment. Kayla Edwin, MBC Prime.